my name is Rikka Yambao. I'm a third-year nursing student, and I will be demonstrating IV administration via Piggyback. So I have my MAR here, which I already compared with my doctor's order, and I have my patient here. Her name is Frida Fritz. She was born on June 4th, 1963, and she has no known allergies. And I also already collected my medication, which is Penicillin G, from my Pyxis. So I'm just going to compare that again. I have the right patient, Frida Fritz, Penicillin G Sodium, and this is Penicillin G Sodium, so that's the right medication. And I have 3 million units as my order, and I have a 5 million unit vial here. I already got my math calculation ready here. So after reconstitution, I will be needing 6 mL of medication, and that will be the right dose. So I have IV. It says can be given IV, so that's the right route. And I have every 4 hours, and it's due right now, so that's the right time and frequency. And it's not expired as well, so we're good with that. So I have my PDM here, or my parenteral drug monograph, and I'm just checking that it's the right medication. So Penicillin G Sodium, and it's an antibiotic, which is the right reason as the patient came in with cellulitis. So it can be administered by a student nurse, so I can administer it. And the usual dosage is 2 to 4 million units every 4 to 6 hours, with a maximum single dose of 5 million units. So our order of 3 million units is within the safe dose. Okay, and then it has to be reconstituted. So I have a 5 million unit vial here, and I have 8.2 mLs of either sterile water, normal saline, or D5W, and I will be choosing normal saline for this, as it is the same solution that is running with our primary, so we know that it's compatible. So 8.2 mLs, the final volume will be 10 ml with a final concentration of 500,000 units per ml. So it has to be further diluted later in a 50 to 100 ml normal saline or D5W within 15 to 30 minutes. I chose the 100 ml normal saline because it is the same as our primary infusion, and it is to be infused within 30 minutes because it's a patient's first time having it, so we can intervene if any of the side effects occurs. So I also checked the compatibility with the primary infusion, so we're good with that. So now I will just do my reconstitution right here. So first, I'm just gonna wash my hands. So
primary line is running,
and then I will be taking my vial here, as well as my normal saline, and my 10 ml syringe. Just gonna wing it back like so, and I will be getting my blood fill needle. Just gonna do that in there. So I'm just gonna take out some air because it's new, and I'm just gonna put it aside. Make sure it's not contaminated as the tip or the cap is still on. I'm just gonna wash my hands again as I'm handling medication. Okay, so now I'm gonna pop the lid open from this vial, like so, and then I will be taking my alcohol swabs. Garbage. Clean it for 30 seconds and let it dry for 15. For video purposes, I'm just gonna verbalize that. And then, as well as my other one, I'm gonna open another alcohol swab, clean it for 30 seconds, let it dry for 15. Like so. And then, according to our reconstitution instruction here, 5 million units, I need to administer 8.2 mLs of normal saline. So I'm just gonna do that. So 8.2. Okay, I just got my air in there. And then I didn't touch the lid, so we're good to inject my air for my normal saline and take out 8.2 mLs.
the fourth that I am going to choose is,
And I'm doing this while maintaining sterility.
because I want it to be controlled by the
Take that.
I'm just gonna choose this forward and clean it for 30 seconds and let that dry for 15.
Okay, like so. And I'm just gonna take out the excess air bubbles.
Tubing.
Okay, now we'll.
And before I give the medication, I'm gonna ask the patient, is it okay if I give you this medication?
And I will just readjust, take out my air bubbles.
Continue with my
Hour, so I'll come back in 55 minutes.
keeping the sterility.
That's my
Make sure that it's
okay. Just take my air.
So now I am going to back dry my tubing by lowering it down, making sure that I remove any bubbles.
Okay, and now that's about 8.2. And just recalibrate it, take out my excess air bubbles.
At least 1/2 to 1/3. So I can do that. So I'm just gonna slap it
Okay,
again.
so I have my 8.2 normal saline right there. And now I'm ready to do my reconstitution. So I didn't touch the lid of the vial as well, so I can just inject on it. And I will do it slowly to prevent any air bubbles.
20 ml per hour. And the volume I have is
Like
110
so.
ml.
And I'm gonna aspirate the excess air to maintain the pressure within the vial. So like so. And I'm just gonna do the scooping method. Okay, I'm just gonna push that back. And I'm gonna slowly roll my vial to make sure that everything is diluted or reconstituted. And so I don't see any clumps in there, everything is dissolved, so we're good to go. And now, according to my calculation, I would need 6 mLs of medication to draw up. So I'm gonna do just that. And I didn't touch the lid of this, so I don't need to swab it again with alcohol. So I'm gonna get that 6 mLs. Inject my 6 mLs of air and aspirate my 6 mLs of medication.
And then I am going to label my tubing so my colleagues know what to change.
I'm gonna take out my excess air bubbles, recalibrate, take out my medication as well.
And then that's all the medication I have for you right now, Miss Emma. And maybe you experience any of the side effects that I had mentioned earlier. Hold on.
Take out my air bubbles,
Within 10 to 30 minutes.
recalibrate it to 6 mLs, like so. And just gonna do the scooping method as well. So like that. And I'm just gonna show you my 6 mLs, so we're good. And then I will just do my labels, which I already prepared for this purpose of the video. So I have here my 6 mLs of medication, and I will do my second check. So I have Frida Fritz, and the medication is Penicillin G, and I have Penicillin G in here, so that's the right medication. I have 3 million units, and it's 3 million units, and I did my calculation right over here. I have a 5 million vial, so my final concentration will be 500,000 units per ml. Therefore, my total medication volume will be 6 mLs, and I have 6 mLs in here, so that's the right dose. And I have IV, it says can be given IV, so that's the right route. And it's to be given every 4 hours, and it's due right now, so that's the right time and frequency. So now, I'm ready to go to the patient's bedside. But before I do that, actually, I would have to dilute it first to my mini bag, actually. And so I have my 100 ml mini bag in here, which I have chosen, as I said before, because it's the patient's first time doing it and getting this medication, so we can intervene if any of those side effects occurs. So first, what we're gonna do, I'm gonna check the integrity of the bag. There are no floaties or anything, so we're good to use it. And so first, I will be doing my alcohol swab right here. Swab it for 30 seconds, let it dry for 15. Like so. And then I will be injecting it into my port while maintaining sterility as well. Because I just touched that, I'm gonna take another alcohol swab. Okay, so I'm just gonna get another one. And for the purpose of the video, I'm just gonna use the same one, but in reality, I will get another alcohol swab to maintain sterility. And I will be cleaning it for 30 seconds, let it dry for 15. So I'm just gonna inject that, like so. Check my medication, and take it out. This can go straight into the sharps container. And I'm just gonna recap it like so. That goes to the sharps. And I have my label here. I'm just gonna put it aside. And I will be putting it here. We'll put it at the side of the bag that doesn't obscure anything. And so, before I go to the patient's bedside, I have my tubing with me for Piggyback, my alcohol swab right here, as well as my tubing label and my MAR. So now, I have it here. So before I fully come in, I'll do my safety check. Patient's not in distress, bed's in the lowest position, and no safety hazards. And I'm just gonna wash my hands as well. So hello, my name is Rikka Yambao. I'm a third-year nursing student. I'm here to give you your medication. But before I do that, I'm just gonna check your wristband here. So can you give me your full name? Okay. And I'm I'm just checking that with the MAR as well. So, Frida Fritz, okay, and when's your birthday? Okay, do you have any allergies? No? Okay, that's what we have here as well. So, I'm just gonna do my third check. And I have my tubing here. Okay, so, and as I did that, I'm just gonna check the side. There is no swelling, there is no exudate, and the patient's not complaining of pain, so we're good with that. And it's the right solution running as well. The tubing is not expired, and it's within the right rate, so we're good with that, and there are no kinks as well. So I'm gonna do my third check. Okay, so I have my Piggyback here. So I have confirmed the right patient, Frida Fritz, and it is Penicillin G Sodium. It's 3 million units, right dose, and I have IV, and it's to be given IV, so that's the right dose, right route. It's to be given every 4 hours, and it's the right route. It's the right time and frequency, so we're good with that. And so now I will be setting up. I will first lower my primary infusion here. So, and then I will just clamp my tubing here, and while maintaining sterility. Okay, so the cap is still on, so we're good. And I'm just gonna make sure that for now it is clamped so as to not waste any medication. We're good with that. Just gonna hang it here. And then I will be cleaning the port that is before the pump, so it will be regulated. So I'm just gonna clean that. 30 seconds is passed, and I will let it dry for 15. For video purposes, I'm just gonna verbalize that, and I will connect it in here in this port. So I'm just gonna show you that, like so. And then I will do my back priming. So I'm gonna slowly open the port, like so, and I will be doing it, filling it about halfway until no air is there. So there's no air in my tubing, so we're good to go. I'm just gonna hang it above the primary. And then I will be setting up my rate right here, so I'm just going to show you as well. So I have my calculation already. So I will be needing 106 mLs because of the 6 ml additional to the 100 ml normal saline. So my rate would be 212 ml per hour because it has to be given within 30 minutes. So I'm just going to do secondary, and then my rate would be 212 mLs per hour, and my volume would be 106. And I'm just gonna go confirm secondary and push start. So just gonna, it's infusing. I'm gonna wait for my 3 drops. There's my 3 drops, so we're good to go. And I'm just making sure as well that everything is unclamped. So this is unclamped and unclamped as well. Everything is unclamped. There are no kinks or anything. I'm just gonna sign off my MAR. So right here, RYUMSNIII. And then I will just come back in about an hour to reassess the site. If any of those side effects that we talked about, the nausea and vomiting, definitely let us know. And here's our call bell. And I will do my safety check. Patient's not under stress, but it's the lowest position, no safety hazards. And then I'm ready to leave.